April is National Donate Life Month, and the goal is to focus national attention on the need and the importance of organ donations. And joining us this morning, Dr. Elizabeth Thomas and Adriana Rodriguez. It's nice to see you. Thank you so much for coming in.
Thank you for having us.
Absolutely. I'm glad we are shedding some light on this. I think a lot of us know someone dealing with kidney issues, and it's important to know what's going on out there. So let's talk about this, because is it true that a kidney has the longest list when it comes to the need?
This is true. So in the country, those who need a kidney is the largest number of people. Of course, there's others who need a heart, a lung, a liver, but the kidney list is the biggest.
And kidney donors can be living or deceased, right?
Yes.
Okay.
Yes,
Tell me about a living donor.
So a living donor, simply put, is the best quality kidney you can get.
Okay.
The surgery is actually exactly the same for the recipient. So if you can find a living donor, you get a better kidney sooner.
Okay.
And that's what's the most important thing.
How do people go about searching for a donor like that?
It's a great question. Well, it can be difficult. And I think for many patients, I can understand this. It's a big ask. It would be difficult maybe
Sure.
to ask your friends or loved ones, your family, to please consider giving a kidney. And as we have the opportunity to talk about today, that's what the Champion program is about.
Okay.
So you may have a hard time finding someone to give you a kidney, but you won't find a hard time like someone who cares about you. And that person who cares about you will be the advocate, will be the person who helps you find a donor.
Absolutely. All right, Adriana, tell me a little bit about your story and your first kidney transplant.
Right, so at this point in time, I do have end-stage renal disease. And I received my first transplant when I was about 6, going on to 7 from my mother.
Okay.
I developed nephrotic syndrome when I was just 3 years old. So I've been on dialysis before. I was on dialysis for about 4 years until I was able to get my mom's transplant or living kidney. But unfortunately, in June of 2022, I was told that I was at end-stage renal disease and that I was going to be put on dialysis. So I am on dialysis at this point in time. Mm-hmm. I actually have a PD catheter, so I do dialysis every night for 11 hours. And twice a week I do what they call manual drains as well. Mm-hmm. So that's where I'm at this point in time. And now I'm seeking a living organ donor. So to please, hear my story and give me life.
Absolutely. I mean, it's just so important to get that information out there. I know she's not alone. There has to be other people in the same situation.
Absolutely.
How can we help, Adriana? I mean, how do you start? Where do you go?
Yes. Well, I mean, she and her champion, her husband, have done exactly the right thing. And that is, you look for opportunities and you tell your story. And we've seen this again and again. If patients are willing to have the courage to just tell their story, tell what they have to live for in their life, we all have something. And it moves people, it inspires them. There's lots of good people out there, so many want to give. And we tell them, just come forward. We do the screening, it's a full evaluation of a donor, and if it's not safe, we won't move forward. So not everyone who wants to give a liver or a kidney is a candidate, but we just tell them, you just come forward and we'll sort that out. And that's how you do it. You just inspire others with the story.
Adriana, what are the next steps for you?
Well, I pray that someone hears my story and helps me out with a kidney, and I can keep living my life and keep on doing. I'm a speech therapist. I work with kids. So I'd like to be able to resume my position full time and help my kids.
Yeah.
So that's what I like to do.
Yeah.
And
Well, it starts right here, doesn't it?
It does.
It starts with getting the word out and talking about things like this that are obviously very, very tough. Thank you so much for coming on
Thank you.
and telling us about what you're going through. And thank you for sharing the information about the Champion program and, of course, living kidney donors. So here's the deal. If you would like a little more information on being a living donor, you can contact our friends at University Health Transplant Institute. Take a look at the screen. The phone number is there. It is 210-567-5777. You can also visit them online at universityhealth.com/services/transplant care.